Hey everyone. So, if you've ever had a major surgery, chances are you've become pretty familiar with one of these, a surgical drain. It's this simple little tube that actually plays a massive role in how you heal, but let's be honest, it's also a huge source of anxiety for a lot of people. So today, we're going to break it all down, what they do, what the risks are, and most importantly, how to manage them for the smoothest recovery possible. The whole point of these drains is to help you out, right? They get rid of all that extra fluid that builds up after an operation. But here's the thing, sticking any kind of foreign object into the body, well, it's never going to be completely risk-free. So to really understand how to manage them properly, we first have to get real about what could possibly go wrong. So let's start right there with the potential complications. Because a drain is technically a foreign object, your body can react in all sorts of ways. It's super important for both patients and healthcare providers to know exactly what to be on the lookout for. First up are the most common things, the day-to-day hiccups. These are the kinds of issues that are most likely to pop up while the drain is still in, and they're often the very first sign that something needs a closer look. Now, these problems might sound kinda basic, but trust me, any one of them can really throw a wrench in the healing process. An occlusion, that's just a fancy word for a blockage, which means fluid isn't going anywhere. Leaking, well, that can really irritate the skin and basically opens up a little doorway for infection. And if the drain gets yanked out of position, it pretty much stops working at all. What's also really helpful to know is that these risks aren't just random. They actually tend to change over time. We can think about them in two main phases: the immediate problems that happen right after surgery, and then the late-stage issues that might not show up for weeks. Okay, so right after the operation, the main things you're worried about are pretty much what you'd expect: pain, some bleeding, or just general irritation. But as time goes on, a whole different set of risks can emerge. Suction necrosis, for example, is when that constant, gentle vacuum actually starts to damage the delicate tissue around it. And way down the line, that little entry point for the drain can become a weak spot and even lead to a hernia. So you might be thinking, okay, once the drain does its job, the risks are over, right? Well, not so fast. The actual process of taking the drain out is a really critical step, and it comes with its own unique set of potential challenges. This means you have to stay vigilant right up until the very end. When that drain gets removed, yeah, there's a risk of pain or infection, but there's also a small but serious chance that the tube could break, leaving a tiny piece behind. It's a delicate procedure that really is the final step of the drain's job. All right, we've spent a lot of time on the problems. That's the scary stuff. Now let's pivot and talk about the solutions, because proper daily management is hands down the single best way to prevent all these complications and make sure the drain is helping, not hurting, your recovery. This simple routine, this is the absolute foundation of good drain care. First, you empty that little collection bulb regularly. To get an accurate measurement, you'll disconnect it from the tubing. And then, and this is the most important part, you squeeze that bulb totally flat before you put the cap back on. That squeeze is what creates the vacuum, that gentle suction that pulls the fluid out of your body. That's what makes the whole system work. Okay, so knowing the daily routine is half the battle. The other half is knowing when to raise your hand and call for help. So let's look at the critical warning signs that tell you something isn't right. These are two huge red flags. If that fluid suddenly changes, like it goes from a clear, light yellow to looking bloody, that needs to be reported right away. And same thing if that drain container just won't stay collapsed. If it keeps puffing back up, it means you've lost the suction and the drain just isn't doing its job anymore. So beyond what the fluid looks like, how much fluid there is also super important. The clinical number to watch out for is 15 milliliters per kilogram of body weight per nursing shift. Now, for an average adult, that could be over a liter of fluid in just 8 hours. That is a crystal clear sign of way too much drainage, and it needs immediate attention. And let's be perfectly clear about this. This is not a wait and see kind of situation. An output this high is a critical threshold. It means you need to report it to the clinical team immediately for evaluation. It's a data point that absolutely requires action. So after all of this careful management and monitoring, we get to the big question. How in the world do we know when it's finally time for the drain to come out? Let's take a look at the criteria for making that call. This decision isn't based on a gut feeling, and it's not just about how many days the drain has been in. It's a clinical judgment, and it's based on clear, data-driven evidence that the body is finally ready. And here it is. This is pretty much the magic number that guides the whole decision. Once the total amount of fluid coming out drops to somewhere between 25 and 50 milliliters over a full 24-hour day, we're talking just a few tablespoons, that is a really strong signal that the body isn't making all that excess fluid anymore, and the drain's job is pretty much done. So really, the decision to pull a drain comes down to two main things. First, you've got the data, the output is consistently low. And second, you've got the function, the drain has served its purpose. When both of those things are true, it's safe for it to come out. You know, if you take just one thing away from our chat today, let it be this. A surgical drain isn't just some passive piece of plastic sitting there. It's an active, temporary tool, and it requires constant vigilance from the clinical team and from the patient to make sure it's paving the way for a successful recovery. And that really brings us to a final question. In this age of high-tech medicine and smart everything, the surgical drain is still a pretty simple device, isn't it? So what does the future hold? Can new technology make this really fundamental part of recovery smarter, safer, and maybe a little less invasive for the patients of tomorrow? It's something to think about. Thanks for joining this explainer. Hey, everyone.